part of the digestive system we're going to focus on is the salivary glands. There are three major salivary glands, the parotid, submandibular, and sublingual, and they're mainly going to produce saliva, and they lie outside the oral cavity. There are some minor salivary glands that augment slightly the amount of saliva produced. The function of saliva is that it cleanses the mouth. It is mainly water, is able to dissolve food and chemicals for taste. Both the chemicals for smell and taste must be dissolved into an aqueous solution in order to be tasted or smelled. So we're looking specifically here at saliva being produced in the oral cavity, and in the oral cavity, it's saliva that causes or creates that aqueous environment, whereas in the nasal cavity, it would be mucus. Saliva is going to be able to break down starch with enzymes because a part of saliva is salivary amylase, and salivary amylase begins the breakdown of carbohydrates in the mouth. Even though salivary lipase is also produced in saliva, salivary lipase is not active until it hits the stomach. The parotid gland is going to be in front of your ears or anterior to the ear. It sits outside of the masseter muscle or external to that muscle, and it has a duct that opens up into the oral vestibule of the oral cavity. That is going to be near your second upper molar. Inflammation of the parotid glands is called mumps. And the submandibular and sublingual glands also have ducts that open up into the oral cavity. The submandibular gland is located near the mandible. It's medial to the body or middle part of the mandible. Its ducts open near that lingual frenulum that connects the tongue to the base of the oral cavity. And the sublingual gland is located under the tongue, and it has 10 to 12 ducts that actually open up all around the floor of the mouth. So here we can see the parotid, submandibular, and sublingual gland, and their ducts that empty into the oral cavity. Again, these glands are the major salivary glands that produce saliva, that moistens food, allows for taste, and secretes some enzymes. There's two types of cells in salivary glands, serous cells and mucus cells. The serous cells secrete a more watery fluid that contains the enzymes and some ions, whereas the mucus cells secrete a more mucus or viscous fluid. The parotid and submandibular glands mostly secrete the watery serous fluid, whereas the sublingual glands secrete mainly that viscous mucus fluid. Most of saliva is water. You can see the statistic here, 97 to 99.5%. It does have a slightly acidic pH. The ions you would find in it are sodium, potassium, chloride, phosphate, and bicarbonate. And the two enzymes we've talked about thus far are listed here, salivary amylase and lingual lipase. You also may find some urea or uric acid, which are nitrogenous wastes produced in the body, and some defensins and lysozymes and immunoglobulins like immunoglobulin A can be found around the tonsils, which trap pathogens in their tonsillar crypts. We produce 1.5 liters of saliva a day. There are glands that intrinsically produce saliva in order to keep the mouth moist, but the major salivary glands are activated by the parasympathetic nervous system. We talked earlier in the other video about the parasympathetic stimulation being an activation signal for the digestive system activity. It would be the sympathetic nervous system that inhibits digestive system activity. So ingested food is actually acting on chemoreceptors and mechanoreceptors, which communicate with the brain stem or a part of the central nervous system and cause information to then travel back to the digestive system, specifically the salivary glands, and cause the production of saliva. So strong sympathetic stimulation would inhibit salivation, where we're seeing here that salivatory nuclei in the brainstem are activated with parasympathetic stimulation. Our next topic is the teeth. So the teeth tear and grind food for digestion. The deciduous teeth you may know as baby teeth. There's about 20 deciduous teeth that erupt about 6 to 24 months of age, and then 32 permanent teeth, which you may call your adult teeth, and all but your third molars you can see of your 32 permanent teeth by the end of adolescence. The third molars should appear or erupt about the ages of 17 to 25. It is possible that they do not erupt at all. These are the classes of teeth: incisors, canines, premolars, and molars. Premolars are also known as bicuspids. Both the premolars and molars have broad crowns, so they're great for grinding. The molars are the best grinders. The incisors are the chisel-shaped teeth for cutting, and the canines would be lateral to the incisors, and they are the fang-like teeth that tear or pierce. So here we can just see the shape of those teeth. The incisors are the most superior here in the picture on the right, followed by the canine, also called an eye tooth. The premolars or bicuspids are next, inferior to the picture of the canine. And the last one there with the broadest crown would be the molars. There are dental formulas which are shorthand to indicate the number of deciduous versus permanent teeth. Just remember there are 20 deciduous or primary teeth. There should be 32 permanent adult teeth. And you would have both incisors, canines, and molars in the deciduous teeth total, whereas there are incisors, canines, premolars, and molars that make up the 32 permanent teeth. So we're missing the premolars in the deciduous or primary teeth calculation. Next, we're going to look at tooth structure. The crown is the part of the tooth you can see. It's exposed above the gums. The gums are called the gingiva. The crown is covered by enamel, which is the hardest substance in the body. It's a hard substance because it's made of calcium phosphate salts, which are also called hydroxyapatite crystals. These calcium phosphate salts make a really hard substance that you see when you brush your teeth, or you clean when you brush your teeth. The enamel-producing cells do degenerate when the tooth erupts. So once a tooth is destroyed, or if it decays, or if there's a crack in it, you can't heal that enamel. The root of a tooth is the portion embedded in a jawbone. It's connected to the crown by a short segment called the neck. So the root is embedded in the alveolar socket. If we were to look at tooth structure, we can see that the first two upper molars have the most roots. They have 3 roots, as opposed to the 1 root for canines, incisors, and premolars, and the 2 roots for the first 2 lower molars. Third molar roots do vary, but they generally still only have a single fused root. Cement is calcified connective tissue. It covers the root, so it's also found in that alveolar socket. It actually attaches the tooth itself to the periodontal ligament. The periodontal ligament is a fibrous piece of tissue that forms a joint called a gomphosis. So it's the fibrous material that forms a gomphosis or peg and socket joint. So it's anchoring that tooth in its bony socket. The gingival sulcus is a groove between the crown of a tooth and the gingiva or gum borders on each side. The dentin is under the enamel, so you cannot see it if you were just to look at someone when they smile and look at their teeth. The dentin is a bone-like material that's under the enamel. Inside a tooth, you have a pulp cavity. It's a wider cavity where you find not only some connective tissue, but the vascularization or blood vessels and nerves that go to a tooth, which this pulp cavity contains material that came up from the root canal, which is an extension of the pulp cavity, and the extension of the pulp cavity called the root canal extends to the apical foramen, which is at the proximal end or bottom of the tooth, and this is how the blood vessels and nerves and other connective tissues entered from the tooth to the pulp cavity. So this image here shows us the crown located above the gums, the root located below the gums. We can see the gingiva or gums lateral to each side of the tooth. We can see in the middle a pulp cavity that's expanded and contains blood vessels and nerves. We can see a narrowing of that pulp cavity, that's the root canal, and the blood vessels and nerves exit the base of the tooth via the apical foramen. The tooth itself is sitting in an alveolar socket. We see that cement is connecting the tooth to the periodontal ligament, which is fibrous tissue that creates a gomphosis or peg and socket fibrous joint. Next, we'll look at some homeostatic imbalances associated with teeth, such as cavities, also known as dental caries. Dental caries occur when demineralization of the enamel or even the dentin occur because of bacterial action. Bacteria can break down sugar and produce acids or debris that adheres to teeth and creates dental plaque. That acid from the bacteria, when it digests sugar films and other material that is left on your teeth, that will dissolve calcium salt. So it will dissolve the calcium phosphate salts that make enamel hard. And proteolytic enzymes are able to digest other organic matter. And again, these proteolytic enzymes and the acids are all coming from bacteria. Prevention of the production of proteolytic enzymes and acid includes daily flossing and brushing of the teeth. Gingivitis is inflammation of the gums. This occurs when plaque, or the dental plaque we just talked about, isn't treated and calcifies and forms a hardened structure called a calculus. This is also known as tartar. So the calculus gets wedged in between the gums and the teeth, and it disrupts the seal between the gums and the teeth, allowing that bacteria, which usually performs anaerobic respiration, to move into or infect the gums. But you can reverse this infection if you remove the calculus and then begin to maintain proper dental hygiene. Severe gingivitis can turn into periodontitis, so it is important to treat gingivitis. Periodontitis is when immune cells respond to the inflammation in your gums. They attack not only the bacterial intruders, but also nearby body tissues, including the periodontal ligament and bone. So the activated osteoclasts in the bone of the mandible and other nearby facial bones can start to dissolve. This can lead to disruption of alveolar sockets and possible tooth loss. It can be a risk factor for developing atherosclerosis and clot formation in coronary arteries or cerebral arteries. Risk factors that make periodontitis more severe include smoking, diabetes mellitus, and oral piercings. And that is it for Part A of the digestive system. Part B and C to come soon.